Gentlemen, let me recognize the gentleman from Ohio, Dr. Wenstrup, to inquire.
Thank you very much, Mr. Chairman. Thank you all for being here. You know, in healthcare, doctors need to administer the right level of treatment that gets the job done without doing more harm than good. And I think that that goes the same for efforts on climate change. I mean, you as doctors understand you may have a medication that'll save someone's life, but if you overprescribe it, it may actually take their life. Recently, I read an article that came out of the National Oceanic and Atmospheric Administration that said that where we are cleaning the air more, it is actually heating the earth. And it's creating more hurricanes and storms, and they're basing it on 20-year data, that with less pollution, we get more hurricanes and storms, and it heats the earth, and that's what brings on. So that's from NOAA. You can look it up and debate that, but it tells me that we need to have further discussions, make sure we're not over-prescribing. We got to be smart about our energy policy. We can't afford to crush American families with higher costs or put our health at risk with crippling energy shortages. You know, I take the all of the above strategy when it comes to energy, do things smartly and what's going to work best in a certain area. I believe that we have great technologies in the United States for cleaning up our atmosphere. We've got to be exporting those technologies, because right now what I seem to see is as we take one step forward in cleaning the air, the rest of the world is taking 2 steps backwards, burning more coal, doing things. And last I checked, the world goes around every day, every 24 hours. And so we need to take a 360-degree approach to everything that's taking place and what's being reported and what the actual facts on the ground are, so we do things smartly, so we don't do more harm than good. And, you know, if we're going to energy sources that rely on China, such as batteries and solar panels, we're putting ourselves at great risk as far as our national security and our health security. I think about the hurricanes that took place in Puerto Rico. You know, if it weren't for generators, those hospitals are shut down, and those generators are running on fossil fuels. Like it or not, they were saving lives that day. And not just that day, but for weeks at a time. When I served in Iraq as a surgeon, we had generators going 24/7. I'd rather have something else. I'm all for going to alternate sources of fuel, but we have to do it with what we can do for the benefit of mankind at the time. And I've been in the operating room at home when the power goes out, but it comes right back on because of the generators that are there at the hospital. So, you know, what may seem like an evil to some actually is saving lives at other times until we get to the point where we can do something else. I was at a baseball game at Wrigley Field 20-some years ago. It was so hot, they were watering everybody down. You just get in line to get watered down. You know what? Because of the power brownout, 500 people died in their apartments. Now, that's not healthy either, is it? So we have to be smart about the things that we're doing. We need an energy abundance in this country to bring down costs and ensure that we have a reliable grid so that we can take care of people. And I think we make a mistake when we demonize sources of energy that we have to rely on if we're going to be able to save lives and provide care. Go through your hospitals, I know you have. Everything has a buzzer or a beeper or a bell, and it all relies on energy. So I get that. I'm a co-chair of the Doctors Caucus, and I want to tell you what healthcare providers are actually caring about, I think, throughout the country, and that's being able to keep their doors open and to treat patients. And instead of using our time talking about healthcare providers, what they really care about, we're talking about a Green New Deal, when this isn't helping patients today, and it won't. I'm all for changing things over as time if it makes sense, but we're not there. And if we're going to be talking about health care, let's look at the ill effects of what we may be doing to ourselves. So let's be careful, let's be smart. I have solar panels at home, and I'm on the grid. I use it to the best advantage I can that makes the most sense. So let's not jeopardize taking care of people by these ideas that something is going to cause more danger when we're getting reports, too, that maybe we're causing more harm than good. I don't know. Maybe we're actually heating the earth with the things we're doing. Mr. Powell, can you discuss how efforts to demonize fossil fuels and block energy infrastructure like pipelines hurts the reliability of our nation's energy supply to the detriment of our healthcare system and to patients?
Well, thank you, Dr. Wenstrup. Thank you as well for your support and championing of the permanent 45Q incentive. So that's the the furthest reaching incentive that proposal that exists today to permanently reduce emissions from the existing fossil and industrial infrastructure. That would go a long way towards solving a lot of these problems and keeping energy and supplies affordable for the healthcare industry and the broader economy. I'll come back to a simple point. It's not the fossil fuels that are the problem, it's the emissions from the fossil fuels that are the problem. If we can get those emissions under control using advanced technology, and if we can do that affordably, we can have both a continuous steady supply of low-cost affordable energy, and we can reduce emissions here at home and around the world.
Thank you. Yield back.